Assalamualaikum warahmatullahi ta'ala wabarakatuh. I am Abdul Jalil Colonel Romaras II. So for today's video, I'm going to discuss the taeniasis. The disease human taeniasis is a parasitic infection caused by the three or tapeworm species or T. saginata known as the beef tapeworm, the T. solium pork tapeworm, and the T. asiatica, the Asian tapeworm. Humans are the only host for this taeniasis tapeworm. Humans pass the tapeworm segments and or eggs in feces and contaminate the soil in areas where the sanitation is poor. The taeni eggs can be survived in a moist environment and remain infected for 3 days, and for the days or months, cows and pigs become infected after the feeding in areas that are contaminated with the taenia eggs from the human feces. So once they're inside the cow or the pig, the taenia eggs hatch in the animal's intestine and migrate to the strengthened muscle to develop into the taeniasis, causing a disease known as the taeniasis. Taeniasis can be survived for several years in animal muscles. Humans become infected with the tapeworm when they eat raw or undercooked beef or pork containing infected taeniasis. So once inside the human, taeniasis migrate to the small intestine and mature to the adult tapeworms, which produce the segments and the eggs that are passed in the feces. So the causative agent, the taeniasis in human, is a parasitic infection caused by the tapeworm species. So the saginata, beef tapeworm, is a taeniasis pork tapeworm, and taeniasis Asian tapeworm. Humans can become infected with these tapeworms by eating raw or undercooked beef. So saginata or pork T. solium and T. asiatica, people with the taeniasis may not know that they have a tapeworm infection because symptoms are usually mild or non-existent. So the mode of transmission, tapeworms and eggs. Normally, they enter the human's host from the animals are via food, especially the raw or undercooked meat. Humans can also become infected if there is a contact with the animal feces or contaminated water. When the infection is passed from the animal to the human, it is called zoonosis. So, the incubation period. So, the incubation period is 8 to 10 weeks for T. solium and 10 to 14 weeks for the T. saginata. Symptoms may include abdominal discomfort, weight loss, and anorexia, nausea, insomnia, weaknesses, and perennial periodicus, and nervousness. So the clinical manifestation signs are symptoms. The physiognomic signs, the tapeworms may be asymptomatic with the symptomous release for the peritonitis. For the T. saginata, consider the only primary physiognomic sign that associated symptoms are often non-specific and included weight loss and abdominal pain and vomiting, diarrhea, constipations, and alternate appetite. So, the medical management, the drug choice are medication for the treatment of taeniasis, including praziquantel, pyltricides, and albendazole and albendiazole. Both drugs are delamitics, which means they can kill parasitic worms and their eggs. In the most cases, their medication are provided in single dose, so they can take a few weeks or to fully clear an infection. So praziquantel is the medication most often used to treat active taeniasis, given at the 5 to 10 mg orally once for the adults and the 5 to 10 mg orally once for the children. So, the nursing responsibilities. So, letter A is the disease prevention, and letter B, the control nursing priorities in the care of the patient. So, letter A. So, the most effective way to prevent the taeniasis is to cook food thoroughly. This means cooking meat to a temperature above 140 Celsius for 5 minutes or more. Measure that the meat temperature with the cooking thermometer. After cooking meat, allow it to stand for the 3 minutes before cutting it. So letter B is be prioritizing care. Nursing can be ensured that the high priority intervention are completed first. followed by the medium priority, and then low the priority intervention. As the time allows, it will be likely not be possible for a nurse to plan how to accomplish and all the activities within one shift. So I think that's all to the video, and wassalam.